Excellencies, ladies and gentlemen, good afternoon, everybody. It's a great pleasure to address the opening remarks of the series webinar on the recent prioritized zoonotic disease for Somalia, organized by Somali One Health Center of Bulaale University. I would like to thank everyone here today for being part of this prestigious event. It's a tremendous honor to see so many One Health stakeholders from the government, internationals, and the private organizations, to have so many distinguished and high-level speakers on the agenda, and to welcome all the participants. Zoonotic diseases are very common in Somalia and around the world. Scientists estimate that more than 60% of known infectious disease in people can be spread from animals, and 75% of new infectious disease in people come from animals. The recent pandemics has reminded us of the deep connections between health and the environment. Adopting a One Health approach is critical not only to prevent the outbreak in zoonotic diseases, but also it's a very urgent environmental issue, including food safety and antimicrobial resistance. One Health is an approach in which multiple stakeholders and sectors work together to achieve better public health outcomes. It's rooted deep in the recognitions that human health and animal health are interdependent and bound to health of the ecosystem in which they or we all belong to. The complex nature of the interactions between the people, animals, and the planet renders this collaboration, multi-sectoral and transdisciplinary approach critical to addressing future health risks and challenges. Although awareness of One Health as an approach is steadily growing, unless this is translated into action, the world remains vulnerable to future outbreaks. Practical frameworks are needed to design and implement One Health programs. Policies, legislations, and research that, although initiated and adopted by the government, must engage community members, particularly those living in rural settings, areas, and compounds, are among those most vulnerable to change in the environment and the animal health. Community members are those, therefore, essential to informing One Health policies, and their networks are vital in putting One Health approach into practice. Excellencies, ladies and gentlemen, education is the center of the integration of One Health approach. Awareness is the base of this One Health approach. With the national strategies, and educational institutions should support government and community efforts by initiating formal framework to teach One Health principles so that they can be easily applied in a practical setting. I would like to thank Bulaale University in championing One Health approach, private institutions through pioneering educational model, through the University Center of One Health and their voluntarily work with the ministry. Students will be trained at Bulaale University to think holistically, prioritizing collaborations, multi-sectoral partnership, and are equipped with the tools to design and deliver innovative, equitable, and evidence-based solutions to complex global challenges. We are grateful as the Ministry of Health for the excellent effort they choose to take to support the community. Recognizing that no single organizations can tackle the complex challenges of global health on its own, we promote collaborations and advocate for greater global health governance that covers all aspects of animal, human, planet, and ecosystem health. Recognizing this need, Somalia One Health Center of Bulaale University has developed a serious webinar on prioritizing zoonotic disease in Somalia. Nation I urge all participants One Health awareness and action generally. The Ministry of Health has taken several actions to consider this in our earlier and technical working group creation model. We welcome all the institutions, partners, international coordinations, and other university institutions and other institutions to work with the ministry and to work with the Bulaale University's One Health Center to increase and make a change in One Health approach. Together, we must highlight the need for all stakeholders to adapt to the One Health approach to increase the effectiveness of medicine and the healthcare and accelerate progress towards the national agendas and the SDGs. With all that, I would like to announce the webinar on prioritize zoonotic diseases of Somalia is now officially open. Thank you for your attention.